Welcome back to Season 2, Episode 15, our question and answer session of Workers Comp Unwrapped. I'm your host, and with me is Aisha, bringing 15 years of experience in the workers' comp industry. Today, we're tackling your burning questions about workers' comp fraud, picking up where we left off in our previous episode.
It's great to be back. It seems like our last episode really resonated with everyone. We got a flood of insightful questions.
Absolutely. So let's dive right in. One listener asks, what should I do if I suspect a patient is exaggerating or faking their injury? I imagine that's a tricky situation for providers. It's a balancing act between providing care and protecting yourself.
It is. You want to trust your patients, but you also need to be vigilant. One thing that can really help is meticulous documentation. Not just writing down what the patient tells you, but really paying attention to the details and looking for inconsistencies.
What kind of inconsistencies should providers be looking out for?
Think about using a body chart. Have the patient mark where they're experiencing pain, and then compare that to your objective findings during the physical exam. Let's say someone claims debilitating back pain, but during the exam they can bend and touch their toes without any issue. That discrepancy is a red flag and needs to be documented clearly.
That's a really practical tip. Using a body chart like that creates a visual record that's hard to dispute. But what if even after careful documentation and examination, a provider still strongly suspects fraud? What's the next step?
In those cases, it's important to remember you're not alone. You can report your concerns to the insurance carrier or your state's Workers Comp Fraud Division. They have investigators who can look into the situation further.
That's reassuring. It can feel intimidating to go up against potential fraud. So knowing there are resources and procedures in place is helpful. Speaking of feeling intimidated, another listener asked, can my practice get in trouble if I unknowingly treat a fraudulent claim? That's a concern I'm sure many providers share.
Of course. It's a valid worry. The good news is that if a provider genuinely wasn't aware of the fraud and followed all the proper billing and documentation practices, they're less likely to face serious consequences. Investigators focus on intent. They want to see that you were acting in good faith.
So it's not about catching every single instance of potential fraud, but rather about demonstrating that your practice operates ethically and diligently. Accurate records are crucial in these situations.
Absolutely. Thorough and accurate documentation is key. Think of it as building a strong defense. If an investigation does occur, your records are your best protection. On the flip side, problems arise when there are inconsistencies or sloppy practices. For instance, billing for unnecessary treatments or failing to verify medical necessity can raise red flags even if you weren't aware of the fraudulent claim. These actions could lead to accusations of billing fraud.
It sounds like providers need to be incredibly diligent. Even when dealing with seemingly straightforward cases, every detail matters.
That's right. Compliance and meticulous record keeping are non-negotiable. They protect both you and your practice.
Now, shifting gears a bit, let's talk about reporting suspected fraud. One listener asked, how do I report suspected fraud without facing retaliation? Whistleblowers often face challenges, so I understand why someone might be hesitant to come forward.
It's a valid concern. Thankfully, most states offer anonymous fraud reporting hotlines. This way, individuals can report their concerns without revealing their identity.
That's good to know. Are there any specific examples you can share with our listeners?
Absolutely. In California, you can report fraud through the Department of Insurance Fraud Division. And in Florida, there's the Division of Investigative and Forensic Services. Most states have similar setups.
So there are resources available to protect those who come forward. What about providers who work in hospitals or large medical groups? Is the process different for them?
In those cases, it's best to consult with your compliance officer or the legal team within your organization. They can guide you through the appropriate reporting channels and ensure you're protected.
Okay, great. Now let's talk about employer fraud. One listener asked, what's the most common type of employer fraud that providers should be aware of? I'm curious to hear your insights on this, Aisha, especially from your extensive experience in the field.
One tactic we see frequently is employee misclassification. To get lower insurance premiums, employers might label high-risk workers like construction laborers as clerical staff.
So they're essentially trying to make their workforce appear less risky than it actually is to save money on insurance costs.
Exactly, but this puts their employees at risk. Imagine a construction worker gets injured on the job, but because they're classified as a clerical worker, they might not receive the appropriate benefits or compensation.
That's incredibly unethical. It's disheartening to hear that some employers would prioritize profits over their employees' well-being. Are there any other common employer tactics that providers should be on the lookout for?
Unfortunately, yes. Another tactic is pressuring doctors to downplay injuries. Some employers try to influence medical providers to classify an injury as minor to avoid a formal workers' comp claim.
Wow, that puts providers in a difficult position. On one hand, they want to maintain a good relationship with their patients' employers, but on the other hand, they have an ethical obligation to provide accurate medical assessments. How can providers navigate that delicate balance?
It's a tough spot to be in for sure. The most important thing is to document any pressure you receive to alter your medical findings, and you should absolutely refuse to comply. Your professional integrity and your patient's well-being are paramount.
It's a powerful reminder that sometimes you have to stand your ground even when it's uncomfortable.
Absolutely. It's not worth risking your license or reputation to appease an employer trying to manipulate the system.
This has been incredibly insightful. It highlights how crucial it is for providers to be well-versed in workers' comp regulations and their ethical obligations. What advice would you give to providers who are feeling overwhelmed by the complexities of the system?
Knowledge is power, especially in a complex field like workers' comp. The more informed providers are, the better equipped they'll be to protect themselves and their patients. There are tons of resources available online and through professional organizations. Don't hesitate to reach out and ask questions.
That's a great point. Learning and staying up to date are ongoing processes. We're here to help demystify the world of workers' comp one question at a time. And speaking of questions, let's move on to another one from our listeners. This one is about
independent medical examinations, or IMEs.
Ah, yes, IMEs. I bet those can be a bit of a mystery for providers who haven't had much experience with them. Our listener asks, what role do IMEs play in workers' comp cases, and how should providers prepare for them? I'm curious to hear how these fit into the bigger picture of a workers' comp case.
That's a question we get a lot. An IME is an evaluation conducted by an independent physician, usually at the request of the insurance carrier. It's important to remember that it's separate from the patient's regular treatment plan with their chosen provider.
So how does an IME fit into the overall treatment process for the injured worker? Is it a collaboration with their treating physician or a separate evaluation?
It's a separate evaluation. The goal is to provide an unbiased medical opinion on the worker's injury, disability, and treatment needs.
So the insurance carrier is essentially getting a second opinion to assure everything aligns with their understanding of the case.
Precisely, they want to confirm that the claimed injury is legitimate, that the treatment being provided is necessary and appropriate, and that the worker's disability status is accurately reflected. It's part of their process to ensure the system isn't being misused.
That makes sense.
Oh.
It's all about checks and balances. But some might argue that requiring all these documentation steps in separate evaluations places an undue burden on providers. How would you address that concern?
I understand the frustration. Documentation can feel time-consuming, but it's essential for protecting everyone involved, the patient, the provider, and the integrity of the workers' comp system itself. When it comes to IMEs, remember that the IME physician will be reviewing the patient's medical records. If your documentation is clear, concise, and complete, it can actually streamline the process.
So no scribbled notes or missing test results. Everything needs to be organized and readily accessible.
Exactly. You want to present a professional and thorough record of the patient's care. Remember, the IME report can significantly impact the outcome of the workers' comp case, so your documentation needs to accurately reflect the patient's condition and treatment.
It sounds like preparation is key. Is there anything else providers should keep in mind when dealing with IMEs?
Communication is crucial. Be prepared to discuss the case with the IME physician, answer their questions, and provide any clarification they may need. It's also a good idea to prepare the patient for the IME as well.
What kind of preparation does a patient need for an IME?
Make sure they understand the purpose of the evaluation, what to expect during the exam, and the importance of being honest and forthcoming with the IME physician. You'd be surprised how many patients go into these feeling apprehensive or confused.
I can imagine. It's probably not every day that someone's evaluated by a doctor they don't know, especially when they sense an element of scrutiny or distrust.
That's why open communication and clear explanations are so important. Put yourself in their shoes and try to address their concerns proactively.
That's a great point. Now let's shift gears a bit and talk about the emotional toll that workers' comp fraud can take on providers. We haven't really touched on that aspect yet. One listener asks, how do you deal with the emotional stress of suspected fraud cases? It must be tough to grapple with the idea that someone might be taking advantage of the system.
It absolutely can be. It's understandable that dealing with suspected or confirmed fraud cases can be emotionally draining for providers. We enter this profession to help people, and it can feel like a betrayal of trust when we encounter situations where individuals might be exploiting the system for personal gain.
Have you encountered cases where a provider was wrongly accused of fraud? What was that experience like?
I had. It's incredibly stressful for the provider. It's not just about the potential legal and financial repercussions, but also the damage to their reputation and the emotional toll it takes.
That must be incredibly difficult. In those situations, what kind of support is available to providers?
It's crucial for providers to have a support system in place. Talking to colleagues, mentors, or even seeking professional counseling can help process those emotions and develop healthy coping mechanisms. Sometimes just having someone to talk to who understands the complexities of these situations can make a world of difference.
That's a good reminder that we all need support, especially in challenging professions like healthcare.
It's not a sign of weakness, but rather a sign of strength to recognize when you need help and to reach out. Taking care of your mental and emotional well-being is just as important as taking care of your physical health.
I couldn't agree more. So we've covered a lot of ground today, from the practical aspects of documentation and reporting to the emotional challenges providers might face. Before we move on to our final question, are there any key takeaways you'd like to emphasize for our listeners?
Absolutely. First and foremost, remember that knowledge is power. The more you understand about workers' comp regulations and your own ethical obligations, the better equipped you'll be to navigate the system successfully. Secondly, don't be afraid to ask questions. There are resources available to help you, whether it's your state's workers' comp division, professional organizations, or even colleagues and mentors.
Those are great points. It's a reminder that we're all in this together. And speaking of together, let's tackle our final listener question for today. This one is about the financial implications of workers' comp fraud. Our listener asks, what are the costs associated with workers' comp fraud, and how does it ultimately affect providers and patients? It's a question that gets to the heart of why this issue is so important.
That's a great question, and it's one that often gets overlooked. Workers' comp fraud isn't just an abstract concept, it has real-world financial consequences. Estimates suggest that fraud costs billions of dollars annually across the U.S.
Wow, billions. That's a staggering amount. Can you break down where those costs come from?
Sure. Think about inflated medical bills, unnecessary treatments, and prolonged disability payments. Those all contribute to the overall cost. Then there are the costs associated with investigations, legal proceedings, and increased insurance premiums.
So it's a ripple effect. Fraudulent activities drive up costs for everyone involved in the system.
Exactly. Ultimately, providers might see lower reimbursement rates, and patients may face higher healthcare costs or difficulty accessing necessary care. It's a lose-lose situation for everyone except those committing the fraud.
It sounds like a vicious cycle. The more fraud there is, the more costs increase, which further strains the system and creates more opportunities for abuse.
That's a good way to put it. It's why it's so important to address fraud proactively. By implementing safeguards, educating providers and patients, and supporting strong anti-fraud measures, we can help mitigate these costs and protect the integrity of the workers' comp system.
Aisha, this has been an incredibly insightful conversation. Thank you for sharing your expertise with us and for shedding light on such a complex issue.
It's been my pleasure. I always appreciate opportunities to discuss workers' comp and to empower providers with the knowledge they need to navigate this challenging landscape.
And to our listeners, thank you for submitting such thoughtful questions. We appreciate your engagement and hope you found this Q&A session valuable. Remember, knowledge is your best defense against workers' comp fraud. Stay informed, stay vigilant, and don't hesitate to reach out if you have any further questions. Let us know your questions and feedback in the comments section below.
Until next time, stay safe and informed.